Jane Francis Nakasumba, who is 56 now, had a normal childhood, going to school and eventually joining a convent to become a nun. All went well until she received news about her graduation day. Then, her state of great excitement quickly developed into fast episodes of mania.
So after that, I was too much excited, talking too much, no, not having a sleep, talking words which are not connected. So the sister said, what is this? So they decided to take me to Mulago Hospital, and those of Mulago, they referred me to Butabika Hospital.
In 1984, long after she had left the convent, Nakasumba conceived. However, she fell into a depression, which unfortunately caused her to miscarry. Coming out of that state was very difficult for her since she had lost her only child.
And when it was about the time of delivery, I fell down. So by that time they took me to Zambia Hospital in a coma.
What Nakasumba did not know then, and what she has had for more than 20 years, is called a bipolar disorder. This is a serious illness that causes shifts in mood, energy, and ability to function.
And they're not even sure why they're excited, but they feel extremely happy. There are people you might find even dancing on the street. They are singing. They feel so energetic. They feel they own the world. They feel they own many other things. They're in charge of everything. They have a lot of energy. They can control everybody. They are talking a lot.
Bipolar episodes can occur at any time in life, though most cases begin when someone is between 15 to 25 years. At least 1 in every 100 adults has bipolar illness, and at Butabika Hospital, a third of the mental illness patients are bipolar. But what causes bipolar disorder? Why would a normal, healthy person suddenly fail to control their emotions?
A person produces some of the common useful chemicals in excess, and when they discharge these in excess, they go hyper, they get the excitement. Now at some point they fail to produce the required chemicals in normal quantities, so there they go low, they suffer the depression. So the problem with bipolar is that a person is failing to regulate the level of hormones that are required to keep the mood normal.
In some cases, a person with bipolar disorder might feel psychologically unwell, but a check by a doctor will not confirm any ailments.
The problems that they develop here are psychological, but they are generated by the kind of problems that they have.
Even if the bipolar illness is one of those mental health conditions that are easily managed and treated, most of the health workers who are not well conversant with mental health issues end up misdiagnosing it, putting the patient's life at risk. It is one of the hardest ailments to diagnose. The illness can be managed within 6 months and can be treated effectively over the long term. Nakasumba has not had a relapse in 20 years. She tells NTV that she's a very good tailor and also a peer educator to mental health patients in Butabika Hospital.
Because I feel bad as I am working in the hospital. I feel bad to see someone discharged and in 2 weeks she or he is back. So why I counsel people is to learn on me, to see that as Jenny has managed to be alive, when it is not relapsing every time, even myself, it can come to me.
Apparently, it's one of those mental disorders where we have very, very good response to medication. Once we get them early, we institute treatment early, the outcome is very, very good.
People with bipolar disorder need support and understanding, and most importantly, the right diagnosis and treatment. And especially for those with hypermania, they may develop severe mania or depression if they do not get proper treatment. Irene Namialo, NTV.